So I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, your email address in the chat box. Please include the names of your companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. So there will be group pictures at the start and end of the pep talk. Please show your face in the video. As a reminder, after the pep talk, please take the online learning group evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown here. So the link has been placed in the chat box by Abet. Another reminder, obtaining 50 OLETE certificates will entitle one to a voucher for a free ROJoson telemedical consultation, like the one shown here. Another request will be to please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Okay? Ready? All set? One, may pahabol? Okay. 1, 2, 3. Okay. 1. I'll just save it first. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer depending on the enthusiasm, discipline, and perseverance of everybody, including me. My pep talk today is entitled Generics Awareness, the Generic Law, and the Generic Medicines. This is in consonance with the Department of Health Awareness Calendar, in which the month of September, we celebrate the Generics Awareness Month. So the empowerment objective is for the lay people to have an essential understanding of the generics law and generics medicine in their health management. The contents of this particular pep talk will be the following. What is the meaning of generic in a non-business context as well as in the business context? What are the so-called generic or branded versus branded goods? What are the generic name or versus branded name drugs? What are the differences and similarities? And how are the drugs named? What is the Generics Awareness Month? What is the generics law in the Philippines? What is the current state of implementation of the Philippine generics law? And lastly, what are my advice on the use of generic medicines? I like to have disclaimer to say that all the contents of my talk will be the thoughts, perceptions, opinions, and recommendations. This comes from my personal experience, from my personal reading, and also from the readings from experience of other professionals. Let's start with the first topic. What is the meaning of generic? I like to start with this topic because there are a lot of confusion going on on the generics law, okay, what it really means, but it has some similarity with the generic goods, the generic products. So let's start with the so-called baseline or the generic definition of the generic itself. So what is the meaning of generic? Generic in the non-business sense or context means It's the characteristics of or relating to a whole class or group. So examples are, so when you say tissue, this is a generic word for any soft, thin piece of paper that's good for wiping something, like the runny nose, like the toilet tissues, etc. And when you say social media, this is the generic phrase for Facebook, Twitter, Instagram, and other apps. So now we go to the generic in the business sense. So this refers to the products or goods companies market without a trademark, brand name, or any distinguishing features. So examples. So in the business context, it can be the generic or versus branded goods or products, or the other category is what we're going to discuss today, the generic versus the branded drugs. Let's start with the generic versus branded goods or products, not drugs. So generic products are those that we name only by their basic product type. In other words, we do not name them by their individual brand. Example, when you say sodas, colas, now what we're doing is using the generic name. But when we say Coca-Cola, Pepsi-Cola, and others, no, that's the brand of the generic goods. Okay, so a word about trademark, just to facilitate understanding of the definition of generic. Trademark is an easily recognizable and unique symbol, phrase, or word that denotes a specific product or used to represent a business or its products. But nowadays, all generic goods have a brand name to identify the manufacturers para kumita naman sila, okay? O para lumago ang business. So there's really a brand name, okay? So there is we know that there is a popular company called now No Brand Company. So sinabi instead of putting a sophisticated name, commercial name, he just said no brand. Okay, so this is to denote that they are selling all kinds of generic products, and the connotation there is that they are really cheaper than the branded products. So what is the meaning of generic drugs? And in relation to this, what is the main difference between generic name and brand name drugs? So for generic drugs, there is a special definition compared to the generic goods. I just defined what is generic goods. Now I'm defining what is a generic drug. So again, we start with the comparison between the so-called generic name drug and the brand name drugs, because this is also a commonly used term, which also leads to a lot of confusion, okay, which I'm going to expound later on. Brand name drugs are essentially pioneer or innovator drugs. So those who invent it for the first time, okay. So the drugs that they invent are the so-called brand name drugs. This is the usual connotation. No? So the pioneer drugs sold by a drug company under a specific name, may brand or trademark, but these are protected or have been protected by a patent. A patent ito. Okay? Whereas generic name drugs have the same, although they have the same active ingredients as the brand name drugs, but they are sold only after the patent of the brand name have expired. So practically the same, they have the same active component. Ang kaibahan lang dito, yung the so-called brand name drugs are those the original drugs that are protected with patent. So while the patent is on, nobody can produce the generic name drugs. So drug patents for the pioneer or innovator drugs are usually good for 20 years after the drug inventions. I like to tell you this background there because this will explain why the pioneer drugs are really more expensive. Okay. But although it's 20 years, but only about 10 years for the drug company to have exclusive marketing rights after the drug because it's usually take 10 years to have it approved for human use, for human beings, for patients. No? So practically only 10 years to exclusively market the drugs. So for the branded, the other, as I said, telling you the background on the patent of the drugs. Okay, so the drug-based patents protect the inventors because of the huge expenses entailed in developing the drugs. Huge expenses in research and development of the drugs, and also the testing and then clinical trials. Okay, so this is the main reason for the higher cost of the innovator drugs. And because of the high expense, they should be protected. Rightfully, they should be protected for at least 10 years. But note again, nowadays, every drug has a brand name and a generic name. All generic name drugs and brand name drugs contain a generic name and the brand name. So lahat meron na. Kaya sinasabi mo, generic ba yan? May brand name din siya. May brand name drugs, no? So essentially, it has the generic component of the drugs. So generic drugs are pharmaceutical drugs that are equivalent to a brand name medication in strength and dosage. They're also the same in quality, performance, intended use, and route of administration. So pareho lang sila, especially in terms of the active ingredient. Generics possibly contrast with the brand names in terms of taste, packaging. Baka mas maganda yung packaging ng innovators, and color. However, they are identical in every other sense. So we have to remember that they have the same active ingredients. Kaya halos pareho lang ang action, strength, and dosage, and also the performance. So as soon as the patent of the brand name drugs expires, other companies can now compete selling the generic versions. So maghihintay sila ng 10 years, no, or 20 years, no. So usually 10 years kasi doon lang malalaman kung effective sa tao in gamot. So therefore, the generic drug is a drug that competes, no, naglalaban nito with the brand name drug after the patent expires, no. So to summarize this portion of the lecture of the talk, generic drugs not covered by patent protection and which are labeled by their international proprietary or generic name. May pangalan din pero generic name. So pioneer drugs or innovator drugs are drugs initially with patent protection. So that's the main difference between the two. Then when you say brand name, lahat naman may brand name. So this is the proprietary names given by the manufacturers to distinguish their products from their competitors. So in short, all drugs have a generic name and a brand name. And nowadays, it is difficult to distinguish pioneer drugs except for the price. So kung gusto niyo malaman kung which is which, you just ask. Ask the doctor, ask the pharmacist. Itong gamot na may brand name, no? Is it pioneer drugs or the drugs that come after the expiration of the patent? An example here, a brand name drug or innovator drug of paracetamol. The pioneer drug is Panadol. Okay, so nung nag-umpisa itong invention of paracetamol, it's called Panadol. So it has a patent for about 20 years. Okay. So after that, nag-expired na siya. So nung nag-expired yung patent, you now have Tempra, Biogesic, and other generic drugs that came out. So these are the generic drugs. Now, Tempra, Biogesics, they are very popular. May brand na rin siya, may brand name. No? But they are essentially containing the so-called paracetamol. So they compete with the Panadol. Kaya mukhang natalo ni Panadol na mas popular na yung Biogesic and Tempra. No? So the next topic will be how are the drugs named? Drugs often have several names. There's so many drugs kung minsan nakakagulo, nakaka-confuse, but they also have several names. Hindi, nakaka-confuse, di ba? Gulo-gulo, no? So, let me tell you how the drugs are usually named. So when the drug is first discovered or invented, it is given a chemical name. The chemical name is the name of the content, molecular and anatomic structure of the drug. Okay? And the chemical name is usually too complex. Even ako, nahirapan ako ma-recall, ma-remember, to memorize, because it's so too complex and cumbersome for general use. So a shorthand version of the chemical name is usually used. The chemical name, when it started with the chemical name is also the same as the generic or official name of the drug. This is what really identifies a drug, the chemical name or the generic name. If the chemical name is short, then it is used as is the generic name. So pareho lang. No? If long, the shorthand version is used for generic name. Yung mas maikli, para madaling maintindihan, ma-remember. So then, after that, may chemical name na, may generic name na, then the manufacturer places a brand. Okay. So ito yung trademark niya, ito yung that will show ito yung pag-aari nila, no? A trade name. So examples, paracetamol is the chemical or generic name, no? Sa lahat ng gamot na may paracetamol. Panadol, which is the pioneer drug, no? And then Biogesic is a generic name, generic drug, clever generic drug. So these are, ito lahat ito, may pangalan din ito. No? This is a brand name, Panadol, Biogesic, Tembra. Okay, but they contain the same thing. Paracetamol ang content nila. Again, for those who have been taking tamoxifen for a long time, no, you should understand this. Tamoxifen is the chemical name or generic name of the drug, no, and the pioneer drug is called Nolvadex. So, ito yung pinakamahal, Nolvadex. And then, one of the generic drugs that is cheaper is called the Tamoxen. Tamoxen or yung iba, Gyroxen, o iba, meron pag iba doon. No? So these are all brand names. Actually, lahat ito brand names. No? Okay. So for the same drug, which is tamoxifen. Another example, phenytoin is the chemical or generic name for an anti-seizure drug. Okay. So this is the generic name, but when the Dilantin, which is very popular also, this is a brand name for the same drug. Okay. Yeah, mas mahal ito. If you have a company that sells only the generic phenytoin, mas mura. Okay. But the effectivity and safety are the same. So what is the Generics Awareness Month? The month of September is known as the Generics Awareness Month. This celebration aims to spread awareness among the Filipino people about generic drugs that are, we want to emphasize that these are as effective and as safe and lower cost as the so-called originators, original drugs. The third celebration also aims to promote and ensure the distribution, the use, acceptance of drugs and medicines identified by their generic names. So what is the Philippine Generics Law? It is known as the pinaka-original nito is the Generic Acts of 1988 or RA 6675. So this is an act to promote, require, and ensure production of an adequate supply, distribution, use, and acceptance of drugs and medicines identified by their generic names. And this act is done for the benefit. This is a law. Law usually is good. They try to aim for the benefit for the welfare of the citizenry. So this is for the benefit of all the Filipinos, especially the underprivileged ones who cannot afford the more expensive drugs. So to provide them with lower cost drugs, so they're more accessible to these drugs already because of their lower cost, but they're the same in terms of effectivity and safety as the more expensive drugs. There is another law related to support the Generic Acts of 1988. Kasi nakita nila, medyo may mga kahirapan doon sa mag-implement ng original law. So they came out with another law, but this is related to the first one, Cheaper Medicines Act. So this amends the part of the Generic Acts and now requires all the pharmaceutical companies to produce, distribute, and make widely available generic drugs. Again, these are for the benefit of all Filipinos, especially the underprivileged ones, to provide them with lower cost drugs. What is the current state of the implementation of the Philippine Generic Law? So the Generic Act of 1988 and the Cheaper Medicine Act of 2008 aims to help the Filipino people in their medication needs. But unfortunately, 35 years from 1988, that's 35 years, 15 years from 2008. So a long time has passed and the Filipino have not taken full advantage of the benefits intended for them. So what are the causes, the root causes? Okay. So the root causes can originate from the government, from the drug manufacturer, from the retailers, from the physicians, and also from the consumers or patients. So I don't like to pinpoint, put a accusing mark to anybody of this, but I think all of them play a role in the problem. So I don't like to dwell on the causes also, but rather give advice to you, the lay people, as part of my patient empowerment and how to maximize the benefits given by the laws of the generic. So my foremost advice is generic drugs are effective and safe as the innovator and pioneer drugs. Okay. So this is coming from his doctor, Dr. ROJoson, saying that they are effective and safe. Okay. So the genetic drugs are of lower cost, mas mura, compared to the pioneer drugs. So I want iba-iba yung markup, iba-iba yung pababa, no? But there is really a marked difference in prices between the pioneer and the generic drugs. Most likely, all of you experience, the difference between pioneer and generic drugs. So because it is safe, effective as the pioneer drugs, and they are cheaper than the pioneer drugs, I really advise you to use them. Use the generic drugs instead of the pioneer drugs. So another specific advice is, if given a prescription by a physician, pag pumunta kayo sa doktor, may prescription kayo, I would advise you, so ask him or her how much do the medicine that he or she prescribed cost. Tanong lang ninyo. Sometimes they know, sometimes they don't know. Okay? So, but if they know, well, mas maganda. So then ask them whether the prescribed drug is a pioneer drug or generic drug. Okay? Again, sometimes they know, sometimes they don't know. But you can help the advocacy by stimulating them to know, because they should know. The doctor should know how much the prescribed medicines cost, not exactly the exact amount, but kahit na estimate lang. And they should know which are the more expensive drugs or the cheaper drugs. Then ask a follow-up questions, whether there are medicines or other brands with the same active ingredients. Okay, basta sabihin mo lang, meron bang gamot with the same active ingredients, okay, that cost lower, mas mura. Okay, so if the physician practices patient-centered and compassionate care, he or she should be able to give advice on the above questions. Okay? So importante yung tatanong yung doktor, no? Okay. Now, when buying medicines in any drugstore naman, If the physician does not insist on a particular brand, kasi may mga doctor na insist na itong gusto ko, okay, wala kang magagawa, na? Okay, kung talagang susundin mo siya, na? Okay. So even if you ask him, meron ba mas mura, at meron ba mas pareho ba na may active ingredients, but if they insist on a particular brand for whatever reason, baka from experience, this is better than the others. Okay? So you don't have any choice but to just follow, no? Unless you cannot afford it. Okay? So always ask the pharmacist, okay, when you are in the drugstore, if there are generic drugs with the same active ingredients or the same chemical name. So wag niyo kakalimutan itong phrase nito, with the same active ingredients and the same chemical name. So ask him or her which ones are the pioneer drugs and which are the generic drugs, and inquire on the comparative cost. So ask a follow-up questions on whether there are other brands with the same active ingredients or chemical name that are of lower cost. Okay. So if the pharmacist practices patient-centered and compassionate care, he or she should be able to give advice on the above questions. I guess sa mga drugstore may mga tao, mga pharmacists na tutulungan kayo. But there are others, of course, who don't care. Bahala kayo. Basta matapos lang yung trabaho ko, bigyan ko lang kayo ng gamot, mabenta ko kayo. Okay? So this is a myth, common myth. Pioneer drugs are more effective and are of higher quality than generic drugs because they are more expensive. Basta more expensive, mas magaling, mas higher quality. Okay, this is false. As I said, pioneer and generic drugs contain the same active ingredient. Okay? Nag-iba lang sa kanila yung patent, no? Yung patent na pag may patent, yung innovator drugs pa rin, no? Pero mas mahal, no? So because they contain the same active ingredients, naturally you expect they should be equally effective and safe. Then all generic drugs are effective and safe. Ito pa isang caveat, as long as titingnan yung packaging, as long as they are approved by the Food and Drug Administration. So kung approval of Food and Drug Administration, so you just remember that you just have to trust the Food and Drug Administration, and that yung pioneer and generic drugs are of the same strength, equally effective. So ang bilhin na lang ninyo yung generic drugs. So in my personal experience, as a patient, I also use generic drugs. I don't like to use the pioneer drugs if the generic drugs are available. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on generic flows and generic medicines. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan, to gain greater control over decisions and make better decisions on generic law and generic medicines in your health management. So I have discussed all of these topics. Okay. I won't mention them one by one anymore. So this ends my pep talk. I hope I have empowered you to have an essential understanding of generic laws and generic medicines in your health management. So before we go to the question and answer portion, as a reminder, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. Then 50 OLED certificates will entitle one mentee to a voucher for a ROJoson telemedical consultation. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the question and answer portion. Okay. All set? Oh, kompleto na si Christy. Okay, 1, 2, 3. Okay, the floor is now open for questions, comments, consultations, etc. Okay. So, I'd like to take would like to take to throw the first questions or to make comments. Anybody? Sharing of experience.
So,
Okay, Chuchi.
I just want to make a comment. I'm surprised why after 15 years, you said that the Filipinos did not really, benefit for, or Filipino people have not taken the full advantage of the generics law. Maybe because maybe because of their preconceived idea that the generic drugs are not effective, no?
Yeah.
Not as effective. So it's
Yeah.
so sad because especially even the poor people, I mean, those who cannot afford it, they're the very people who should be buying.
That's true.
And yet, but anyway, yun lang po.
Yeah. Kaya nga sabi ko nga kanina, I don't like to expound further on the real cause, but I think all the yung mga persons, the institutions that I mentioned really play a big role, no? Okay. So, and since mahirap mapalit, no, I hope one day we'll be all of us will adopt the generics, but I think also in other countries ganun din ang problema, no?
Ganun din.
Except probably sa India, no? There's an imposition of the law, lahat generics, di ba? Okay, some countries, no? Okay. So dito sa Pilipinas, I think all of those people that I mentioned or institutions played a role, no? Merong kakulangan, no? Okay. So even the doctors, di ba?
The doctors also, that's what I was about to say, because the doctors have a lot to do with it also, because they probably benefit a lot from advertising.
Yeah.
From advertising the branded ones, because they benefit from it, no?
Yeah, marami ring mga stories about ilagay-lagay, diba? Incentivize the doctors, no? So which is true also, okay? So kaya my secretary can vouch for me, walang med rep pupunta sa akin sa clinic ko, no? Okay. So I don't like to be tempted. Okay.
So you're not the favorite pala of you're not the favorite of the pharmaceutical companies.
Hindi. No. So tsaka when they prescribe, they don't kasi there's a law that requires the doctors, when they make a prescription, they should start with the generic name, no?
Yes.
Followed by a brand name to their preference, no? So what they usually do, they prescribe yung pioneer drugs o yung mga kakatsokaran nila, yung paboritong drugs nila,
Yes.
no? They usually paborito, no? Not based on analysis of the so-called BRCA, no? Benefit Risk Cost Analysis, no? Kasi yung benefit and the risk would be the same for, let's say, 3 kinds of drugs of the same chemical contents, but ang magkakaiba na lang will be the cost and availability, di ba? So, kung yung isang gamot noon is the cheapest na among the 3, dapat yun ang i-prescribe, no? And then,
Yes,
kung
yes.
yung gamot ay hindi available, yung cheapest is not available, they can go to the next more expensive, yung second, no?
Yes.
Okay. So yan ang application of my BRCA also, the benefit risk cost analysis comparison, no? Okay. So
Thank
that's why
you.
we just have to start with our own selves na lang. Kaya I think yung sinuggest ko, it's the most practical advice, you just ask. Don't be afraid to ask. No? The doctors will not charge you higher of their professional fee if you ask. Di ba? You just ask. Di ba? Okay, matakot. No? Okay. So, tsaka when you ask, that's a challenge din sila. They will now say, oh nga, no? Ito pala, pioneer drugs ito. Kasi kadalasan di rin namin masyadong kabisado which are the pioneer drugs, which are the generic
Yes.
drugs, no? Kasi sa daming gamot, no? Na may pare-pareho may brands, no? May brand talaga lahat ng gamot. We don't know now which one is the generic, which one is the pioneer drugs, no? Kaya ang sa akin personally, kasi hindi ko rin ma-memorize yung yung mga which are the pioneer drugs, which are the generic drugs, tinitingnan ko na lang yung prices. No? Doon na lang ako nagre-rely. Kung mas mura ito, most likely generics yun, no? Pero who cares, basta mas mura at effective naman. No? Okay?
Okay, thank you.
You're welcome. Any more comments? Sharing of experience?
Yeah. Can I say something?
Yeah.
Kasi as in my own experience, yung mga cardiac medicine kasi, meron kasi mga cardiac medicine na you're going to take it once daily. And then, pag meron generic kang binili, normally, sasabihin is, when you take that, take it 3 times a day instead of this one. So, I think it has something to do with the potency of the generic medicine and the branded medicine.
Ano yung last comment mo, no?
Yung potency, I think the potency of the generic medicine and the branded medicine are way different. Mas ano yung potency ng branded sa generic, I think, ha?
Yeah, sino nagsasabi noon? Tas,
Mm-mm.
yung mga doctors, if they prefer something, yun ang sasabihin sa pasyente. These are more potent than the other brands, generics. Kaya itong piniprescribe ko, no? Okay. But worldwide, even sa US, I think they're encountering also the same problem because of the mindset of the patients, no? Kung yung quality, gano'n. Pero they're telling us, no, na pareho lang in reality, no? And I have experienced that also. I use the same drugs, these generics. Wala namang problema, no? Okay. So you can always, syempre, hindi naman lahat ng gamot, even with the same generic names, no, will have the same effect on a particular patient. Kung minsan may hiyang nasa isang gamot, no? Kung minsan, hindi uubra yung isang gamot, no? Something went wrong, probably because of the, let's say, may problema sa konting manufacturing, no? Or, kung minsan, because of the, may konting side effect because of the mga ingredients, yung mga side ingredients, no? Kasi kino-compound rin yun, no? Okay. So, and then the other factor is, of course, yung tao mismo, no? Iba-iba ang makeup ng tao, genetic makeup. May hiyang sa isang gamot, hindi siya hiyang sa isang gamot, kahit na pareho yung chemical names, no? Okay? Any
Like for
more?
example, Aspilet and aspirin. So mostly other patients will say na pag inake nila ang aspirin or aspilet, may tendency silang sumakit ang stomach nila. So they will go to some with the same effect na iba lang din ang generic pero the same, like yung aspirin hindi na ibibigay sa'yo, ibibigay naman sa'yo is clopidogrel, which is more higher and more expensive than aspilet or aspirin. Maybe because of the side effect.
Yeah. Kaya nga, yung approach really is you can try out aspirin, yung pinakamura, no? And then kung meron siyang side effects doon, you can shift. Justified ka to shift, no? Okay. So, pero nowadays, maraming nagpe-prescribe more expensive drugs, wala na yung aspilet, di ba? O konti na yung aspilet, no? Pero in the past, we know that when we prescribe, wala pa yung clopidogrel, they are very effective also, di ba? They are very effective, no? Okay. So, anyway, kung merong mga alternative medicines, you just have to make a decision based on a patient's condition. Kung nagre-react siya o ano, no? Okay. But I usually try the cheaper ones, the generic ones, no? Okay, before I change it, no? No. It doesn't mean that you have to stick to the generic drugs all the time. Kung di kakayanin, then no, it's not accomplishing your purpose, then you can shift to another drugs, no? Basta bantayan lang, no? Okay. Any more? Any more questions, comments?
Nothing more at the chat box.
Nothing in the chat box?
Nothing.
Okay. So,
Hello, Doc.
hello. Yeah,
Hello, Doc.
Jocelyn.
A while ago, I typed a question sa chat box. Pero why kaya hindi nag-appear?
It did not appear.
Yes. I asked if generic drugs usually half price ba when compared to the branded ones.
Again? Half price?
Yung generic, half price ba yung generic drugs?
Hindi lahat. Kumisan may half price. Kaya that's why I cannot really say how much. Basta may difference, no? I don't know the exact amount, no? Okay. So iba naman kasi yung bagong labas ng, let's say, innovator drug after expiration, syempre mahal pa yon, di ba? So let's say 100 pesos. And then lumalabas na yung mga generic, pwede na kasi maglumabas ng generics. So tinataas na yung generic, let's say 50 pesos, no? Nag-umpisa. Then nakita ng Pioneer Drugs na company na malakas ang kalaban. So they tend to lower the prices. So instead of 50 pesos difference, baka ibababa na nila to 80 or 70, no? Kaya magiging 20 pesos difference na lang.
Na lang.
You know?
Yes.
Total, kumita na rin sila yata. Kaya pwede
Nauna na silang kumita.
Okay. So,
Thank you.
yeah. Any more question?
Another one, Doc.
Sure.
You mentioned na hindi kayo masyado nag-entertain ng mga ahente ng drugs. How can you be updated na, oh, ito na yung bago, ito yung luma?
Andiyan na may internet eh.
Oh.
Andiyan na may internet. I don't have to go to their luncheon, luncheon meeting, dinner meeting.
Can I answer that question, Jocelyn?
Sige, yes, of course.
It's because Dr. Hosen do not prescribe antibiotics when he do his operation. That's why most of the med reps are not visiting him kasi hindi talaga siya nagpe-prescribe ng mga antibiotics. He knows when he do his operation, it's clean and Kaya no
Oh,
antibiotic. Only paracetamol.
aha.
Walang kita ang drug company sa
wala.
kanya. Oo.
Wala.
Kaya,
Curious ako, no? How can the drug companies know kung madalas magreseta yung doktor ng medicines nila? Paano nila malalaman?
Sa pharmacy.
Aba, hindi na nila alam kung sino doktor yung nagpe-prescribe.
May
Minsan they
prescription
keep
kasi
track.
they have the list.
They
Yeah,
keep
They
track
keep
of the
track of the
prescription.
prescriptions?
Yeah, they keep track
Oh.
of prescription.
oh, reported yan si Dr. Hoson sa mga drug companies.
Thank you, thank you.
Kaya
We
blacklisted
don't
ako.
usually ask favors eh.
Are there many doctors like Dr. Hoson, if I may ask?
I think there are who are compassionate enough or logical that but probably not the majority. They just put it that way, not the majority. No. Okay.
There are doctors na hindi siya nagpe-prescribe ng particular medicine. Lahat piniprescribe niya. Pero hinahabol pa din siya ng mga ahente. Yun. May ganun doctor na wala siyang particular. Halimbawa, amlodipine, hindi siya nagpe-prescribe just one. Lahat piniprescribe niya. Pero hindi siya tied up sa any other pharmaceuticals. But the med reps and the companies are running after him.
Yeah. Okay. So there's a question here. Why there is sometimes a side effect in using generic drug knowing the fact that it has the same ingredients compared to the pioneer drugs? Yeah, lahat ng gamot, whether it's pioneer drugs or generic drugs, may potential side effects. No? So, hindi lang sa generic drugs. No? So, sino ito? Si Belen, Delen, no? Del Rosario, no? Okay. Okay. Yeah. So hindi lang generic, lahat may potential. May comment ka? Delete?
Hindi, kasi yung mother ko, pag binibili ko ng gamot, binibili ko generic. Sabi niya ayaw daw niya ng generic at hindi daw mabisa. Tsaka minsan daw siya hindi nagaling. Kaya gusto niya branded.
Paminsan kaya nga paminsan na-influence ng mindset no? Bias na sila doon, no? May bias na.
Siguro
Oo, no? Ako.
Na kanyang mind na pag generic hindi mabisa.
Yeah. So as I said, ako lahat ng gamot na ginagamit ko generics. Okay. So,
Opo. Yun nga po, kagaya ng binigay niyo sa akin, yung sa levothyroxine. Dati ho, binibili ko yung isang Eurotrax, medyo mahal, sabi niyo, Tidine. So, Tidine na lang ho binibili ko ngayon. Mas mura.
Yeah. Kasi ang Euthyrox, I think, is the most expensive. No? Most expensive. Do you know, kaya hindi ko nilagay itong, when I was preparing this lecture, initially I was thinking of giving examples of all the drugs. Kaya lang baka magalit sa akin. No? So dito na lang sa open forum tayo mag-discuss. No? So yung Euthyrox ang pinakamahal among the levothyroxine, followed by L-troxine and then Tidine. So usually Tidine ang piniprescribe ko. No? So yung Tidine, okay. So to show you that I am walking the talk, yung Tidine, pinapainom ko rin sa anak ko, sa asawa ko. Yun ang iniinom nila. No? So kung di available yon, that's the time that I go to L-troxine. No? Okay, kung di available. No? Okay.
So, isa pa po, yun sa sa letrozole ho. Ang binibili ko naman yung kung anong available na mura. Kagaya ho ng Letbex. Kasi yung Femara ang mahal-mahal. Isang tablet ay yata 300 pesos.
130?
Hindi ho, 300 ho yung Femara.
300?
Mahal yun. Oo, kaya binibili ko na lang ho yung mura, yung Letdex sa,
Oo.
sa PGH, nagpapabili ho ako doon, mas mura.
85 pesos, di ba?
Oho, mas
Okay.
mura ho.
So 85 pesos, ilang percentage markup yun? 20%?
20% ho.
Okay. Okay. So those are examples, no? Okay. So I hope don't convince yourself that generic drugs are as effective as pioneer drugs. And then number two, also convince your relatives, no, para to help us in the advocacy. And then use them. Use them. I don't think you will regret using them. No? Okay. So if there are no more questions, meron pa ba? Okay. Wala
No more.
na. If there are no more questions, we'll call it a day. So we'll see. Nakataas yung kamay ni Christy. Hindi. Si Christy. So we call it a day, and then we'll have the next one next week, next Saturday. No? Okay. So I'll be going home on Tuesday. I'm now in Quirino province. I just operated on a thyroid with a resident and also a gallbladder operation. No? Akala ko hindi ako aabot eh. No? So, kaya I'm conducting this in the operating room kaya maingay sila. Maingay.
Hindi naman po.
Hindi niyo naririnig?
Hindi.
Okay.
Thank you, Doc.
So, thank you. I'll see you.
Thank you,
next
Doc. Thank you so
Okay,
much.
thank you.
Bye.
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 Give me the number.